Hello, my name is Thomas Jenkins, and I am the manager for the PASRR analytical team. And this is the PASRR Level 1 screening training. So in this training, we're going to focus on the Level 1 screening itself. We're going to give you a little bit of background on PASRR, but we're going to try and keep most of the training time to the Level 1 screening since it is new, and any questions regarding the training Level 1 screening. Everyone's automatically muted when they enter. Please hold your questions until the end, just to make sure that we cover everything, just in case we might answer your question that you want to ask. At the end of the training, we'll have the chat option available where you can type your questions in the chat box, and we'll address them all there. Any questions that are not addressed during the training, you can submit your question to IT Service Desk. Specifically, if we can't answer it right now, we'll ask you to reach out to IT Service Desk so that a ticket can be created and that we can get you an appropriate answer. The purpose of this training is to provide guidance on completing the new Level 1 screening. It's pretty similar to the last one, except for that first section that many of you might have seen. There's some additional information that we're gathering, and we'll explain why we've implemented that information once we start the demo. Before we do that, let's go over some basic information about PASRR, like some common acronyms. Some of the acronyms you'll see on the Level 1 screening specifically are DDS or IDDDRC. DDS is a Department of Developmental Services, and they have control over the IDDDRC section. IDDDRC stands for Intellectual Developmental Disability and Related Conditions. So this is the process that runs parallel to the serious mental illness process. Both processes start with the same Level 1 screening. Some of you might have noticed that the IDDDRC section is a little bit shorter. That's one of the sections that was changed in the Level 1 screening. Next, we have EHD. EHD stands for Exempted Hospital Discharge. This is the only true exemption from the PASRR process. We'll have the definition for that in a second, but the EHD basically requires 3 points in order for you all to use it on the Level 1 screening. That used to be question 19, but now it is question 18 on the Level 1 screening. GAC refers to the General Acute Care Hospital, and that is one of the facility types that discharges to the SNF. SMI stands for Serious Mental Illness, so that's the other process that runs parallel to the IDDDRC process. Both start with the same Level 1 screening. And SNF stands for Skilled Nursing Facility, so this covers facilities with the traditional SNF beds, STPs, and even ICFs. The first definition we want to go over is new admission. A new admission is anyone who's never been admitted to your facility before, or an individual who does not qualify as a readmission. A readmission is an individual who's already been admitted to your facility. They may leave to the hospital to receive care. So these are folks who are already at the skilled nursing facility, and they're anticipated to return back to the skilled nursing facility as long as there's no discharge to the community going to the hospital and coming back. A readmission also counts for folks who are at a skilled nursing facility, go to the hospital, and they're going to be transferred to another facility. That technically is an interfacility transfer, but the same thing happens. Somebody's at a skilled nursing facility, they're going to the hospital, and then they're going to another skilled nursing facility. There is no discharge to the community in that step. So again, readmission, someone who's going to the hospital, going right back to the SNF. Interfacility transfer, somebody who is at one SNF, goes to the hospital, and ends up going back to another SNF. Significant change is important because it determines when a skilled nursing facility needs to submit a new screening as a resident review. A significant change can be positive or negative, but it's a major decline or improvement in a resident's status. As you can see, we have the 3 points here. It will not normally resolve itself without intervention by staff or by implementing standard disease-related clinical interventions. The decline is not considered self-limiting. 2, impacts more than one area of the resident's health and status. And 3, requires interdisciplinary review and or revision of the care plan. Next, we have the definition for the EHD, or the exempt hospital discharge. So you need all 3 criteria in order to mark question 18 as yes. 1 is the individual is admitting to the SNF directly from the hospital after receiving acute inpatient care at the hospital. 2, the individual requires SNF services for the same condition for which they're being treated for at the hospital. And 3, an attending physician at the hospital can confirm before admission to the SNF that the stay should not exceed more than 30 days. And this is to the best of the physician's knowledge based on the information they have in hand. Number 3 needs to be kept in the medical records or somewhere that the hospital can record this information. Number 3 also needs to be able to be produced upon request. So if the skilled nursing facility needs to see the confirmation, the hospital discharging to the SNF should be able to produce it to them. In addition to if the PASRR team requests that information or a surveyor or anyone who needs that certification. Next, we have the definition for serious mental illness. And this definition, I'm not going to read the entire thing, but it is on the level 1 screening. And we've updated the level 1 screening so that when you all complete it on that PDF that's printed out, we have all the tooltips listed at the bottom of the page, just in case you need a refresher on what some of the items go over. So the purpose of the PASRR is to ensure anyone with a qualifying SMI or IDDRC will be evaluated to determine if the services and support specific to those conditions that are over and above what the SNF would be expected to provide as part of their per diem. So as long as an SMI or IDDRC has been identified and it is identified that the person can benefit from specialized services, that is what the PASRR process is for. So make sure when they go to the skilled nursing facility, they can get the help that they need. The PASRR process, the PASS and the RR are required by federal law, Title 42 Code of Federal Regulations. You can look it up. It's 483.100 and it goes all the way to .138. For all Medicaid certified skilled nursing facility applicants, the PASRR process is required, and it does not matter what insurance type or payment source they have. The bottom line is that the process is required for anyone going to a Medicaid certified skilled nursing facility. Just as a reminder, if somebody's going to a skilled nursing facility and they are not Medicaid certified, those of you who are discharging do not need to do the PASRR process for these facilities. Next, we'll go over the SMI process and the IDDRC process briefly. These slides here show the process in a nutshell, broken down between the different responsibilities and the different steps. So as I said before, both processes start with the level 1 screening, but for the SMI process here, you can see that the level 1 screening is done by the facility. From there, it'll go on to our contractor. Our contractor is the one that actually does the work in the field to see if the level 2 evaluation is necessary. And if it is, they're the ones to do the level 2 evaluations. And that is required by federal law. So state staff cannot do the evaluations. From there, once the evaluation is done, the state staff can now step in, and our clinical psychologists are the ones to take that information gathered from the evaluation and produce the determination letter. The determination letter has the end result of the entire PASRR process and also has the specialized services recommended for the facility that they're going to. So the process can stop anywhere between the level 1 screening and up to the determination. Starting with the level 1 screening, if the result is negative, then the person does not need an evaluation and the process is complete. If the level 1 screening is positive and it gets to our contractor, like I said before, they're the ones to determine if an evaluation is necessary. If they determine that the screening is positive, but they don't need an evaluation, then the process will end right there. And then furthermore, if an evaluation does take place, our clinicians, like I said, will produce the determination and close the case. So remember, the level 1 screening all the way to the determination letter with DHCS is the complete PASRR process from beginning to very end. For the IDDRC process, this started with the same level 1 screening, but this process is triggered if one of the questions in section 2 for IDDRC is marked yes. So again, if one of the questions in that section is marked yes, then the case will go to DDS once it's submitted. DDS are the ones to determine if a level 2 is needed for the IDDRC process. If they determine an evaluation is necessary, they'll send that information to the regional centers. The regional centers will be the ones to do the IDDRC level 2 evaluation. So that's different than the SMI level 2 evaluation. They'll produce the PASRR summary report, and then the IDDRC level 2 process is complete. Now, if we back up a little bit and DDS determines, even though the case was triggered for IDDRC, but they determined no level 2 is needed, then the IDDRC process is complete. There's nothing else that needs to happen. And furthermore, if we back up one more step, when you're submitting your level 1 screening, for section 2, if none of the questions are marked yes, then the IDDRC section is negative, nothing is sent to DDS, and you don't have to worry about that process. And keep in mind, all of the information that's sent to DDS is done electronically, so you don't have to submit anything besides your level 1 screening in the PASRR system. There's nothing else you need to send to DDS. So level 1 screening is based on medical records as well as direct observation that might lead the screener to suspect that there is a PASRR condition. There's two types of screenings. There's the PASS and the RR, and the RR is the status update. The hospitals or facilities that are discharging to a SNF are always going to do the PASS. The resident review, again, is a status update, and that would be done by the skilled nursing facility if they identify a significant change in condition. Now, there are situations where the skilled nursing facility can do a PASS. That would be for community admissions, so someone coming from a home, for example, or if somebody's coming from out of state. In those situations, the skilled nursing facility can do a PASS. And if when they're indicating where the person's coming from on the level 1 screening, I can show you where this is. There's an option for other. You can fill in the address and the name of the location where they are. That way, when the contractor, if they're triggered for a possible level 2 evaluation, the contractor knows where the person's location is, and they can work with the facilities to get that evaluation done if they deem it necessary. Now we're going to go into our demonstration. So I'll pull up our staging environment. So there's no PHI here, and we can get right into the demonstration. So I'm going to skip the login. I'm going to skip everything. We're going to get right to the level 1 screening. And it won't let me skip login right now, but I'll put in the password and move forward. So this account has access to more than one facility. We're going to log into 20 Villa Maria. We're going to skip the banner, but keep in mind when you log in the real PASRR production webpage, please pay attention to the banner. Any updates, anything that we think you all should know, we're going to put at the top of the banner. We're going to click OK to move past that. And we're going to go to a new level 1 screening. You can click that on the quick links here or from the level 1 drop-down menu here. So here's the level 1 screening. As you can see, there's some information that auto-populates. We have the facility name based on the facility that you're associated with. Again, if you have access to multiple facilities, depending on which one you click on when you first log in, that'll be the facility information that populates here automatically. We have the facility address, the facility's phone number, and the date that is started. So this automatically generates when you click new level 1 screening. You can't edit it. And the name of the person completing the form. So this should be your name. Some of the new fields that we have here are the direct phone number, and we have the option to put your extension, the discharge planner fax, the facility medical records fax, the direct email of the person who's filling out the screening so that the contractor can reach them directly if need be, and the medical plan information. So let's start with the direct phone number. When you input this information, you want to make sure you're putting just the numbers. You don't need to put any parentheses for the area code. You don't need to put any dashes. Just put in the direct number. So for example, let's put in this number here. As you can see, we're good to go. We have all the digits necessary. If you have an extension, you have the ability to add 5 digits here for the extension. If your extension is longer than that, you can maybe skip it here, and then I can show you where you can input it later. But if you don't have an extension, leave it blank. You don't have to put it in. As you see, it's not mandatory. Any field that has the red asterisk is a mandatory field. The reason why we put the direct phone number in here is because we wanted to try and streamline the process after you all submit your screening. So after you submit your screening, if it's positive, like I said, our contractor needs to reach out to see if a level 2 evaluation is necessary. In order for them to do that, they have to speak with somebody at the facility. Their protocol is to reach out to the person that submits the screening. If the person that submits the screening isn't available, they'll call the main line and try and speak with anybody there. Even when they're trying to reach to the person that submits the screening, they're calling the main line. And with some facilities, it's a bit of a maze trying to get to the person they need to speak to. So we've input the direct number so that if you have a direct number available, when you submit your screening, our contractor can speak directly with the person that submitted the screening and get the ball rolling faster. Now, if staff don't have a direct number, you can just copy the facility phone number and put it here. But remember, get rid of all the parentheses and dashes, just put the number straight in here. So again, we input the direct number to try and streamline the process for our contractors so they can get a hold of you guys quicker, screen your cases quicker so we can close them quicker and get them discharged quicker. Next, we have the discharge planner facts. Again, when you input the number here, you want to put in just the digits, nothing else, no parentheses, no dashes. The plan here is also to assist our contractor with getting the discharge planner's fax number right away. That way, they can get the number right when they get the screening. They don't have to call somebody and ask for it and then send the fax. They can get the ball rolling as quick as possible. Again, if your facility does not have a discharge planner fax number that you can give, you can put all zeros here. And it will pass the logic to allow you to get past this mandatory field. But again, we're providing this number to try and streamline the process, to try and move things along as quickly as possible for you folks at the hospitals. Next, we have a field that is not mandatory, but it's a facility medical records fax. Again, this is part of the process for our contractor. When they call the facility, after speaking with somebody, they'll also speak with the staff to get medical records fax number so that they can request the medical records. So if you can put in your medical records fax number. That way the contractor can fax over the request to medical records and hopefully get those medical records over to see if the level 2 evaluation is necessary. Like I said, this is not a mandatory field. If you don't have this information, you can skip it. Next, another field that is not mandatory but would be very helpful is the direct email. And again, this is the email for the person who is completing the level 1 screening. If you can, put in your email address. That way, if our contractor needs to get a hold of you in regards to trying to schedule the evaluation, they can call you directly or email you. They'll do whatever they can to get the case closed. And last, we have the medical plan information. This is a mandatory field. We provided a few options based off the information we've gathered. We have the Medi-cal number, Medicare, maybe you have a private insurance or not available. This field is mandatory. Once you click on one of the options, a box will appear where you can indicate the medical plan information. The number of digits here is limited. If we need to expand it, we will in a future update. But if you can, indicate what the medical plan is, and then the insurance number. Again, no dashes, no special symbols. We want just the numerals here. No text in here, please. Just give us the medical plan number. And the reason why we've input this information is so the PASRR team, during future projects when we're looking at data, we can cross-check the PASRR information we have with some of the other DHCS systems that we don't necessarily work with on a day-to-day basis. This is very helpful for us when collecting data when we're trying to make improvements down the road with the PASRR system and DHCS in general. So if you can provide this information, please do. Again, if you need more space here, let us know. You can just send a message to IT Service Desk. We'll work on that in a future update. But if you need more space, meaning that you can't put in all the digits, you can click not available. Or if you don't have this information for whatever reason at hand, you can click not available. It'll answer the logic for this section. There's no text you need to input and you can move on. So like I said, anything marked with a red asterisk is a mandatory field. And then all of the tooltips are now numbered. And they have a little blue bubble here. Just like the last screening, the name is mandatory. So I'll put in my name here. First name is mandatory. Middle name is not, so it's an option. I'll put in my middle initial. Date of birth is mandatory. We'll just say I was born today. Screening type is mandatory. So we have the initial pre-admission screening. Remember, this is the screening that is done by the facilities discharging to the skilled nursing facility. And in the rare cases, the skilled nursing facility will submit a pre-admission screening for community admissions and admissions from out of state. When you hover over the little bubble, it just gives you a quick description of what you're doing here. You can click whichever one applies. And here's the brief description for the RR. Number 4 is the admission date. As you can see, it's asking us to input a date here. We have a quick tooltip to let you know what it's for. Let's just say this person admitted today. That's fine. As soon as you input the information, you now have section 2 available. So like I said before, section 2 is the IDDDRC section for DDS. If any of these are marked yes, then once the entire screening is submitted, DDS is automatically going to be notified that they have a case that is possible for IDDDRC. They'll take a look and see if the level 2 is needed for the IDDDRC process. If you mark all of these no or unknown, DDS is not notified, the screening gets submitted, and the IDDDRC process stops here and there, and nothing else happens. The questions have been altered to try and cut down on false positives for DDS. A false positive is when the logic is triggered in the screening to say that something might be here. So either there's possible serious mental illness or possible IDDDRC condition. And then when staff take a look at the actual screening and the information that's submitted, we find out that it is not the case and the case can be closed. So again, DDS has revised the questions here to cut down on false positives. There used to be 5 questions and now there are only 4. So if you want, when you start your new screening, take a look, read the questions, make sure you're answering them correctly. If you mark yes, there is a text box for each one where you can indicate the information that's needed. And then you can move forward accordingly. The purpose of this demo, we're going to mark no for all of these so we can move along. And once you completed section 2, section 3 pops up. So section 3 is very similar to the previous version of the level 1 screening. We have our definition here for serious mental illness. As I mentioned before, you can always take a look at this here during the filling out process of the screening. We are going to do a negative screening first. So I'm going to mark no for all of these. So question 9, is there a diagnosed serious mental illness? We're going to say no. Question 10, is there suspected mental illness? We're going to say no. As you can see, all of these are mandatory. Psychotropic medication. Has the individual been prescribed psychotropic medications for a serious mental illness? We're going to say no. And there is the tooltip here for psychotropic medication. So as I filled out this screening, we have all the mandatory information that is necessary to move forward, the direct phone number, discharge planner fax. We're going to say that we don't have one, so we're going to put all zeros here. For the medical plan information, we're going to say not available. Our patient's basic demographic information. The IDDRC section, we're saying it's all no here. And for section 3, we're going to say there is no diagnosed mental illness, there is no suspected mental illness, and there is no psychotropic medication for a serious mental illness being taken. This person is going to be negative for the PASRR process. The case is going to close right away, and then the person is going to be good to go to be discharged to the skilled nursing facility. So you'll hit submit. You're going to get your confirmation that you're submitting your screening. You're going to wait for that little process to happen. It lets you know what the result is. An evaluation referral is not required. A notice of no need letter will be available from the level 1 case list. That letter basically states this person has no suspected serious mental illness, therefore they don't need to go through the rest of the PASRR process. You hit submit. You wait for this to finish. It should only take a few seconds here. It'll kick you back to your level 1 case list, as it just did. That lets you know that it was submitted correctly. And then we have our case right here. So here I am. I'm no for IDDRC. I have my close date. The case is closed. The resolution is level 2 not required. So level 2 is anything past the level 1 screening. We have our letters here, the level 1 screening that was submitted. the notice of no need letter. Like I said, that letter states this person does not need to go through the PASRR process any further. And we have the history. So the history shows you who worked on the case and who submitted the case. So if I were to go on to the screening, and I can show you in a second here, I can start the case, I can save it after completing section 1, and then I can continue to make changes, saving along the way until I'm ready to submit it. Anytime I come in here and save, a new line will be created, and it'll give me some details on who did what. So it'll either have the same person or someone else. It just depends on who came in here and made edits to the screen. We'll take a look at the PDF real quick to show you how that looks a little bit different. So as I said before, the PDF now has the tooltips on here so that if you guys need a guideline on what the tooltips were, you can scroll down a bit at the end of the screening, and here they are. So they're legend, and they're numbered according to the way they're numbered on the level 1, and you can read what the description is for each. So here is the definition for serious mental illness, and so on and so forth. So let's do the next screening. Let's do a categorical. We'll start the new screening. We'll do another one for myself. We're going to go up here and fill out the information, my direct number. We're going to say we do have a discharge planner fax number available. And of course, you're going to put in the actual number. I'm just copying the same number just to for this demo purpose. We're going to say we do have a medical records fax number we can provide. We're going to say we do have an email. I'm going to put one initial in here just to make sure some random person's email isn't actually put in our staging environment. We're going to say we do have a medical number. And I'm just going to fill in the digits. And that top section is complete. This section is almost complete. We're going to put in the date of birth. We're going to mark this as a pre-admission screening. We're going to put in the admission dates. We're going to say they were admitted on the 18th. We now have the section for IDDDRC. We're going to say that this person has a suspected IDDDRC. Again, you're going to spell out what the suspected IDDDRC is or the diagnosis. I'm just going to put text in here for now, just for the demo purposes. We're going to say that they have experienced functional limitations. So again, you're going to spell that out and explain your reasoning. We're going to say that they have been referred to Regional Center for Services. Again, you're going to spell that information out. You know, what regional centers they were referred to. And then if all of those other ones are yes, especially question 7, most likely they have received regional center services. So you can spell that out here as well. Now, we did complete section 1. So at this point, we can save. We can see the save button is visible here. If you click that, it lets us know that this screening is saved and it's in progress. And it'll be up here in the in progress menu, or on your level 1 case list, or on the in progress list. Any one of those will have your in progress screenings. So let's look on the level 1 case list. There's no submit date because it's in progress. It hasn't been submitted yet. The case is not closed. Again, it hasn't been submitted yet. We can already tell that it's positive for IDDDRC based on how we've answered the questions in section 2. The case state is level 1. Remember, anything that stays with the level 1 screening is considered level 1. And resolution right now is level 1 in progress because we have not submitted it yet. So right now, we just have one line item. Once we go in and continue working on it, we're going to say there is a diagnosed mental illness. Again, you can list the diagnosis here and describe any symptoms. Because there is a diagnosed mental illness, there is no need to suspect they have a mental illness. And if they're on psychotropic medication, you can list the medications here. Again, for demo purposes, I'm just putting text in to get past the logic. And next we have section 4. So this is the categorical determination section. If any of these questions are marked yes, then the system is going to say, hey, despite this person having a serious mental illness, possible serious mental illness, I should say, one of the reasons down here overpowers the logic here. And this case is now on track to be a categorical case. If all of these are marked no, then one of these questions being marked yes means the case is on track for a positive level 1 screening, meaning that this person has a possible serious mental illness and KeyPro needs to take a look. So again, question 4 overpowers section 3 and says, despite this person having a possible serious mental illness, because of one of the reasons down here, they cannot benefit from specialized services, and we're going to let them go over to the skilled nursing facility without the need for a level 2 evaluation. Why is that? Again, the PASRR process is trying to identify possible serious mental illness or IDDRC, identify what specialized services the person can benefit from when they're at the skilled nursing facility. If they have a condition or situation that prevents them from benefiting from specialized services, we call that a categorical condition, and they therefore don't need to go through the entire PASRR process because they can't benefit from those specialized services. So question 12 is asking about a brief stay. So if someone's going to be there less than 15 days, if you mark yes, you can give the reason why. We have two options here. It's either for respite or protective services. And as you can see, no other option here, 13 or 14, can be used because you can only use one categorical reason. If you mark yes for any of these, you do get question 15. Question 15 is saying, since you've marked yes for 12, 13, or 14, please indicate where you got your information from. Is it from hospital records, physician's evaluation, records of community mental health centers, so on and so forth? So you'll mark whichever one applies. If I mark no for a brief stay, I can continue on. And then we have delirium. Delirium is pretty straightforward. It's either yes or no. This is the only question on the screening, if I'm not mistaken. If you mark yes, there's no additional information you need to provide. And here's the tooltip for delirium. So basically, the way the delirium categorical answer works, if you mark yes for delirium, the screening is going to close with the categorical determination, because the categorical is a form of a determination. Once they go on to the skilled nursing facility, when the delirium clears, the skilled nursing facility needs to submit a resident review to see what specialized services this person could possibly benefit from. Remember, the categorical section means that the person cannot benefit from specialized services at the moment, so we're going to skip the level 2 evaluation and the person can be admitted to the SNF. So again, once the delirium clears, the SNF can submit an RR, and then they can see what services the person can benefit from after they've gone through the PASRR process. We're going to select no for those so we can take a look at the severe physical condition. So the severe physical condition is pretty straightforward. Does this person have a situation or condition that would prevent them from being able to participate in and benefit from specialized services? So say, for example, we list some examples here. Are they in a coma? Are they on a ventilator, in hospice? Do they have a neurocognitive disorder? And our clinicians have indicated that a dementia is no longer used. That term is no longer used. They call it a neurocognitive disorder. So we've reworded that here for severe physical condition. But basically, does this person have a condition that prevents them from being able to benefit from specialized services? If you mark yes, you can list the condition here that prevents them from being able to participate in the specialized add-on services. So you would just fill that out. And again, once you get to 15, you can just indicate where you got your information from. We can say it's from a physician's evaluation, and you can move on to section 5. Section 5 is the current physical diagnosis, bed type, and the exempt hospital discharge option. So question 16 here, you're going to identify the individual's current physical diagnosis that requires nursing facility services. So you can input whatever applies. So this used to be question 17 on the former screening. It functions the same. List whatever reasons they need nursing facility services regarding their physical condition, and In addition, we've been telling folks when you're discharging to the SNF, if you know what bed type the person's going to, so let's say they're going to a skilled nursing facility that only has STP beds, it does help to identify what facility they're going to. So if you know the name and you know the bed type, they're going to an STP bed, you can input that here as well. And that just helps to streamline the process again when our contractor's calling to screen the case to see if their evaluation is necessary. If that information's here, they can note it and they can make sure that that stays consistent when they do their evaluation so that when our clinicians do the determination, everything lines up, that the person has already been accepted at a facility, the bed type has already been set up for them. Because again, for the skilled nursing facilities, if the bed type on the determination letter does not match the bed that they're going to, then the skilled nursing facility is going to run into issues with the field office in regards to their payment. So it helps them out if you can make sure all of this lines up before they're admitted. And most skilled nursing facilities might even postpone admission to their facility until this can be aligned. So again, you can input the text here. Make sure everything that applies is indicated here. Next, you're going to identify for question 17 the individual's current location. So where are they right now? Are they at the general acute care hospital, at the nursing facility, at a group home or assisted living, acute psychiatric hospital unit, special treatment program, or intermediate care facility? If your facility type is not listed here, you can input other. And this is also where the skilled nursing facilities, again, if you guys are admitting somebody from the community or from out of state, you can input where they are right here. So you're going to give us a description of where they are. And we have a nice little tooltip here. We have the address, the city, the state. So again, if they're coming from out of state, you can input where they are, the zip code, phone number, and fax. So as you can see, any field that's not filled in that's mandatory, we're going to get the red box to let you know you need to fill it in. But again, for SNFs who are admitting people from out of state or community, fill in information here. Or if your facility type is not listed on here, so for the example, we have a few standalone hospice facilities who've been added to PASRR. For now, you can list other and then input your facility information down here. What will happen is once you submit your screening, the contractor will see this information. For the hospice facilities, it's not a big deal. You guys are in California, so we have staff here that can help out. For folks who are coming from the community setting to the skilled nursing facility, this lets the contractor know where they are so they can work with their evaluators to figure out who needs to go to the location to do the evaluation, or if they need to set up a telehealth evaluation. Same for out of state. That lets us know where they're coming from, and the contractor can work with the skilled nursing facility in California that the person is being admitted to and the facility out of state to get that evaluation done. So for the purpose of this demo, we're just going to do the general acute care hospital. And then question 18 is about the exempt hospital discharge. So if you hover over this, you get your 3 criteria here. Again, who's admitting, or the person's being admitted for the same treatment they're receiving at the hospital, at the skilled nursing facility, the same condition, the same services, and then the final one is the physician certification. Remember, this physician certification needs to be stored in medical records or just needs to be able to be produced upon request. So it's not stored in the PASRR system. As you can see, if I mark yes, no, or unknown, nothing pops up. There's no ability to upload that document in the PASRR system. We just want you to be able to produce it if we request when you mark yes. So keep that in mind. And the physician telling the staff that the person most likely doesn't need to be in a skilled nursing facility for more than 30 days, and then the staff taking note that that conversation happened, is not the physician certification. We need something written by the physician. It could be a handwritten note, it can be an email, it can be an electronic note in the electronic medical records. We just need the physician's direct input that the person, according to their knowledge, doesn't need to be in the SNF for more than 30 days. So once you have all that, you can mark yes. But again, for the purpose of this demo specifically, we're just going to do the categorical. So we're going to mark no. No and unknown do the same thing. You're not marking yes, so this will not close as EHD. So to backtrack just a little bit, we have positive for IDDDRC, so it's going to go on to DDS once we submit the screening. Section 3, we have a positive for serious mental illness, but remember, Section 4, the categorical section, overrides Section 3. Because of the categorical situation or condition, the person can't benefit from specialized services, so there's no need for a level 2 evaluation. Section 4, we have the information we need to gather, where they currently are, what their physical diagnosis is that requires nursing facility level of services. And 18, we're not using the EHD, so we can go ahead and submit our screening. Here's the result. So it always gives you a result after you submit your screening. Based on the information provided, it appears that a level 2 mental health evaluation referral is not required due to the categorical condition. A categorical letter will be available from your level 1 case list after a brief review by the DHS contractor. Please hit submit to finish submitting your screening. So you hit submit. You just wait for this to kick you back to the level 1 case list. If it never kicks you back to the level 1 case list, the system probably timed out. There might have been a slight disconnect between your system and the PASRR system. It might look like it's submitted if you leave the page and come to your level 1 case list, but it didn't. Please trust me, it did not go through if it did not automatically kick you back here. What you want to do is submit that information again, even if the system says it might be a duplicate. Go in and submit it again if the system does not automatically kick you back to your level 1 case list after you hit submit. So the categorical result let us know that there's one more step that needs to happen, and that's the contractor key pro. They're going to come in and they're going to just confirm that this is a categorical condition. They will most likely reach out to your facility and confirm the information that was submitted on level 1. And that's why the case state says level 2. Remember, anything past level 1 screening is considered level 2. Even though this was filled out as a categorical on the level 1 screening, it is now in KeyPro's hands. They'll take a look. Once they're done, they'll close the case. You'll have your close date. And once it is closed, we'll filter the list to show you. You'll have your categorical letter. So you have your level 1 screening now submitted and your categorical letter. So remember, the categorical is another determination letter. You have the determination letter at the very end of the PASRR process, and then the categorical is another determination because you're saying they're good to go to the SNF because they can't benefit from specialized services. Next, we will do the EHD. So again, I've shown you how to fill out everything to get to the EHD. You cannot fill out your level 1 screening without filling out everything to get to the EHD because it's at the end. So we're just going to fill in this information quickly, get down to the bottom. And remember, the Section 4 overrides Section 3, and the EHD overrides everything. The EHD is saying this person is not going to be in the skilled nursing facility long enough to benefit from specialized services, and therefore they do not need to go through the PASRR process to see what specialized services are needed. An example of using the EHD that I saw that I thought was pretty good is, remember, so we're going to say we have all 3 of the criteria here to use the EHD. There was somebody that had they had a serious mental illness. They were on psychotropic medication, but the only reason why they were going to the skilled nursing facility was for physical therapy. The physician certified they shouldn't be there for more than a few weeks. I think it was 2 weeks was the number that they gave us. And that was their reason for using the EHD. So again, the EHD is saying this person's not going to be in the skilled nursing facility setting long enough to benefit from specialized services. So there's no point in them going through the entire PASRR process. It closes just like a negative level 1 screening. You hit submit. Yeah, you want to continue. It gives you your result based on information they provided. The evaluation referral is not required due to the exempt hospital discharge. Remember, this is the only true exemption from the PASRR process. An exempt hospital discharge letter will be available on your level 1 case list. You hit submit to go through. You wait for this to finish. It'll kick you back. And here it is. Case is closed. It's submitted. Close date. Case state is closed. Level 1 exempt hospital discharge. And you have your exempt hospital discharge letter. Finally, we'll do the positive screening. So remember, the positive screening means that the case is going to go level 2. It's going to go on to our contractor. They're going to take a look at the screening, reach out to you, and see if the person needs a level 2 evaluation. So we are going to put in some information here. Now for the extension, I don't think I mentioned this before, it's 5 digits and it requires 5 digits if you put an extension in here. So let's say your extension is only 12. What you'll need to do is preload the extension box with a few zeros and then put your extension. So we'll put 000 and then 12. If your extension is 3 digits, preload it with 2 zeros. If your extension is 4 digits, preload it with 1 zero, so on and so forth. If your extension is 5 digits, just put in your full extension. And that's how you use this box. So if you only put in extension 2023 and you try and move on, it'll give you some errors. So you need to, again, preload that box with some zeros before your extension if you have one. We're going to say we do have a medical records fax number. And we don't have a direct email we can use, but we gave them our direct phone number, so that'll work. Gonna put on our patient's information. We're not gonna do their middle initial, birthday, pre-admission screening, our admission date. We're gonna say no for the IDDDRC section, so DDS is not gonna be notified of anything. We're gonna say that we do have a diagnosed mental illness, serious mental illness. We're gonna put that we are on psychotropic medication for that serious mental illness. We're going to say there is no categorical condition or situation that we have. We're going to list our reasons for physical diagnosis that require nursing facility services. We are going to say that we are at the General Acute Care Hospital, and we are going to say no for the exempt hospital discharge. So once you hit submit, again, you get your reason here. So based on information provides, it appears that a level 2 mental health evaluation referral is required. Please provide the resident and conservator, if available, with the notice of need letter. Please select submit to finish submitting your screening. Now that notice of need letter basically says this person possibly needs a level 2 evaluation and that there are further steps that are going to take place to see if that evaluation needs to take place. Depending on the person you're giving that letter to, it might be a good idea, if it's going to alarm them, to wait to see if the evaluation actually needs to take place or not. Again, Keeper is going to call your facility. With the additional fields we have on the level 1, they'll be able to call you directly, hopefully, fingers crossed. And they'll let you know right then and there if the level 2 is going to be scheduled. They'll give you the date and time and everything. So if you know the evaluation is going to happen, then you can give the individual and conservator the notice of need letter. Again, if they're an individual that might be alarmed by reading the letter. A lot of people read the letter, they get a little caught off guard, and they think the letter is stating that they have a condition or something, and that's not the case. The letter is simply stating, based off the information that we've gathered, they might need a level 2 evaluation, but they might not. So again, use your best judgment to see if you need to give them that letter or not, but it is available once you hit submit. So wait for it to kick you back. The case is not closed because, again, the case is now level 2, so it's gone past the level 1 screening. The resolution is level 1 submitted, so that's good. We can take a look at the level 1 screening, and we have access to the notice of need letter. So remember, the notice of no need says that there's no need for this person to go through the level 2, the rest of the PASRR process based off the information we gathered. This one is stating the level 1's been triggered for positive. That does not mean that they have anything in particular. It's just stating that there's information here that lets us know they might be able to benefit from specialized services. We're going to look into this further to see if they need to go through the evaluation. So that is how you get the 4 results. You have the negative screening. Remember, that ends in section 3 if you mark no for everything in section 3. We have the categorical section, so you need to mark things yes for section 3, but it'll mark yes for section 4. And then you can submit your screening. Keeper will take a look, confirm it's a categorical, and they'll close it as such. We have the positive screening, which means everything is yes in section 3. There is no categorical answer for yes in section 4, and you're not using the EHD. And then we have the EHD. You can mark yes for everything. You can mark the categorical section. It doesn't matter. When you get to the end of the screening, question 18, if you mark yes, it overrides everything and the case will close as an exempt hospital discharge. So that is how you get the 4 results for the screening. And those are the updates for the level 1 screening as well. So now we're going to get into the Q&A portion. PASRR team, is there anything with the new level 1 screening that I should go over? Actually, we're going to go over the information we have if you're having issues. So we did hear some folks are having issues submitting the screening. One of the things we did see is this field, even if you select the correct plan, isn't populating this box. And that could be for one particular reason. Each computer internet browser uses what they call cookies and cache. The cache basically preloads or it saves information from websites. So the next time you visit that website, it loads up faster. The cookies remember the selections you've made on a website so that when you're going through those steps again, it remembers what you did and it can pre-fill information. So say, for example, when I pick it, the facility discharge planner facts, it's remembering certain numbers that I put in the field so I can use them again. This can be an issue because your website's trying to remember what you did with the old level 1 screening and it's not meshing well with the new screening. What you can do to try and resolve the problem, the first step is hold down Control on your keyboard. While you're holding that down, press F5. That will reload the web page, not using your cache or your cookies, and the level 1 screening should work. If that doesn't work, we have a few more options you can try. One, make sure you're inputting all the information correctly. If those fields aren't filled out correctly, it won't let you progress. 2, you can try to manually clear your cookies and cache. And there's different steps you can use. Again, the 2 browsers we recommend using are Edge and Chrome. So for Edge, what you want to do is use the links that we provided in the email blast and PASRR team. If you have the links available, can you put those in the chat? This is the information for, Edge. What you want to do is scroll down and you want to do delete all cookies. They have some other options here, but if you delete all cookies, you don't have to worry that you did it right or that you didn't do it right. The hotkeys to quickly get to your cookie settings in Edge is Control, Shift, and Delete. So when you put that in, it brings up your internet browsing data. So you're going to click everything here. For the time range, select it as all time to make sure you're getting everything, and then hit clear now. Once you do that, you're basically clearing out how your web browser remembers using the PASRR level 1 screening and what you used to input on the level 1 screening. Once it's all cleared, what you want to do is completely close out your browser. So use the big X up here in the upper right-hand corner, clear everything out, and then open it back up, and it should work. If it still doesn't work after doing that, what you want to do is restart your computer. We've seen people clear out their cookies and cache. It still didn't work. After they restarted the computer, everything was fine. I know it's a little bit daunting to do this, but again, we'll send out the links on how to clear your cookies and cache. And then once you do that, again, only if you're having issues submitting your screening, it should fix the problem. If you're still having issues after doing all that, what you can do is you can reach out to the PASRR team via IT service desk, and we can try and set up a meeting with you and IT to see what the problem is. We do have one facility at the moment. Their firewall settings make it difficult to use PASRR in general. That could be the case with your facility, and we can work with our IT team to figure out what the problem is for your facility. If you already have one person from your facility submitting a ticket, there's no need for multiple to do so, because most likely what works for one person at the facility will work for everybody else once we figure out what that solution is. But again, if you're having issues submitting your level 1 screening, it could be filling out the information here correctly. So remember, direct phone number, you're not using any parentheses, no hyphens, just digits only, numbers only. The extension, if you have an extension and you're using this box, remember, you don't have to use it. make sure there are 5 digits in here, even if your extension's only 1, 2, 3, or 4. Just preload the box with zeros before that. And then the medical plan information. If you have a medical plan number and it doesn't fit in here, you can just click not available and you can bypass this medical plan information box. And that's it. That's what I wanted to go over before we address questions. Sorry about that. So PASRR team, we can start the Q&A. I did not take a look to see if any questions came in yet, but Camille, if you have any that you saw, we can get going on those.
Okay, thank you, Thomas. And I didn't have the option to post the instructions to clear cache.
Okay, I can assist with that.
Okay, and I'm just recording the last question, and thank you everyone for putting your questions in the chat. We are gonna go in the order they were received. So let me go back to the top. So one of the questions was asking, so you're just wanting the subscriber ID and not the name of the HMO or medical group.
Yes, yeah, you only want to put the medical record number or the insurance number, and then you're going to pick from the drop down what the type of insurance, for example, is that you're using. But you don't want to put the actual name in the field because it's going to use up some of the characters. So this is our first implementation of this new update. So obviously one of the things we want to do is increase the number of characters in that field. But at the moment, if you can only put the insurance number and try and give us an idea if it's Medi-cal, Medicare, or whatever in the drop down, then that's fine.
Wonderful, thank you. Next question. Do we need an RR for any new start of psychotropics? Example, admitted with an antidepressant, and a few days later, the patient started anti-anxiety.
That's a good question. For the medications, if they're already on medication, then you don't need to start a new screening for that specifically. What our clinicians indicated to clarify things is if they weren't on a medication and they start medication, psychotropic medication, that's when you want to do an RR. If they are already on medication, there's a new diagnosis and the medications have changed, then you want to do an RR. If you're just changing medications and they've already been on something, they said that there's no need to do an RR because they understand that facilities are trying different medication combinations to see what works for the individual. So again, if they're not on medication and they start medication, psychotropic medication, do an RR. If there's a new diagnosis and new medication, then that's a reason to do an RR.
Thank you. And I'm going to combine two of the questions that came in. Yes, the screening has to be closed, which will also include a close date before that individual can be transferred to that nursing facility. And nursing facilities, please make sure you are looking over the screening upon the individual coming to your facility. If you see anything that needs to be updated, that is up to, excuse me, if you see anything on the screening that needs to be updated or something that was omitted, then you as a nursing facility would need to do a resident review as a status update to update that information. Okay, if a patient started on an antidepressant for situational depression due to prolonged hospitalization, do we answer question 11? Yes.
If a patient
for psychotropic medication.
If the patient, I don't know why that question escaped me at the moment. I believe yes. If I'm reading the question correctly, I believe the answer is yes. One of the things I want to mention as well is for folks who are at the hospital, you're not listing psychotropic medication that was prescribed while they're at the hospital. The question is, are they on psychotropic medications? If they're already taking it, they've been stable, but they're taking it, then you want to list it. Um, if they started taking it at your hospital, then you want to list it. But if they are already taking it before they got there, then you still want to list it. But yeah, to answer the question, I believe it was Denise that asked that one. I believe the answer is yes.
Thank you. Facilities, you will receive, when you do a screening and it comes back, it closes as a duplicate, that means a facility prior to that person come to your facility has already had a screening on file. So our biggest thing is to either reach out to the facility if you know where the person came from. If not, please reach out to us at IT Service Desk so we can look up that information so you can have the original screening with you. So that's what a duplicate is, was already done.
Yeah, I want to piggyback on that one. For the skilled nursing facility staff, if you guys are doing a screening, um, once you're getting somebody admitted from the hospital and you're getting the duplicate message, it's possibly because the hospital already did one. Um, what you should be doing is reaching out to the hospital to get the file exchange case from them. You guys should only be doing a pass or an RR for status updates, or like I said, community admissions. So that means they didn't come from a facility, or out of state admissions. So that's another reason why you might want to check and see why you're getting the duplicate message.
Okay, thank you. Well, one of the comments was stating that there was not enough spaces in the medical records number. It's too short.
Okay, yeah, in that field, if it's not working for you, just you can put all zeros and move forward. The most important fields to me are the direct phone number and the discharge planner fax if you have it. But direct phone number for sure, because like I said, the biggest hurdle we've seen since we've onboarded all the hospitals in California is getting our contractor in contact with staff at the facility to screen the case to see if that level 2 is needed. A lot of time is wasted there, and that's the biggest hurdle in the PASRR process. So if you can't get that medical records fax number in here, just put all zeros, and we will work on an update where we can expand some of these fields to accept more characters.
Thank you. Okay. Would a diagnosis of encephalopathy be considered as a mental illness?
That's a good question, Don. We consider that a clinical question. If you can provide that question to IT Service Desk, and I'll give you the contact information on the website here in a second. If you can send that into IT Service Desk, we'll ask one of our clinicians, and we'll get back to you on that answer.
Thank you. What if we're receiving a resident from the ER and there's no PASRR? What would happen? So this is a very good question. We do see this a lot. We do try to see if the staff at the hospital, not the ER staff, but the staff at the hospital can go ahead and do the screening for you. But if that cannot happen, then we are going to ask that you please reach out to the nursing facility and let them know so they can go ahead and do that screening for that individual. So again, anyone coming from the emergency department, we do ask for the hospital to do it, but if not, nursing facilities, you do need to go ahead and complete the PASRR. And I know we're 4 minutes behind. I'm not sure if you want me to continue with questions.
Yeah, let's. If they're still coming in, yeah, let's address some questions now. For everybody who's on, we are recording this training session so we can put it up on the webpage. Since there was a lot of confusion after our update last Thursday, we are going to have another training next week. It hasn't been scheduled yet, and the new training schedule is going to go up next week as well at the latest. So if you have any questions, feel free to put them in the chat now. If we can't get to them now, we can get to them in the next training session. But yeah, we can go for another 15 minutes, Camille, since we this is the first one.
Okay, wonderful. And as we're stating that, I just wanted to put in our IT service desk For questions that we weren't able to answer or get to, you're more than welcome to reach out to them so we can get that question answered for you moving forward. So next question I am seeing, for an example hospital discharge, can the provider just make a comment in the progress note that states anticipate patient stay at nursing facility be less than 30 days?
Yes, as long as that's the physician's note and the facility can provide that information to DHCS, the SNF, anybody that requests that information, then yeah, that's fine. As long as you can produce it later, that's the biggest thing we need, and that the physician put that note in.
Thank you. How long will it take for a categorical review to be processed and cleared? Do we get a letter to share with the SNF? What will the letter be classified as?
Those are excellent questions. Let me get back to level 1 case list. So when you submit your screening for categorical, it'll be in categorical review. The contractor should be calling you within 24 hours to screen the level 1 and make sure that it is a true categorical condition. Once they're done doing that, you'll have this resolution down here. It'll be called a level 1 categorical, and you'll have your categorical letter that'll be populated here under the letters icon. Now there is a level 2 categorical, and the way you get that is you submit your level 1 screening. The screening result is a positive level 1 screening, so the categorical section was not marked yes. When KeyPro calls to see if a level 2 evaluation is necessary, sometimes they find out the person has a situation or condition that should have been marked yes in the categorical section, and then they'll close the case as what they call a level 2 categorical. So those are the two ways you can get your categorical. Either you identify it on the level 1 screening, or KeyPro identifies it when they dig a little bit deeper when they have a positive level 1 screening. Both of which, when they close, the resolution will be level 1 categorical again if you identified it, or level 2 categorical if KeyPro identified it. And then the letter will be under your letters icon. And this one's in review, so it's not there yet, but it'll be under your letters icon. And another note, KeyPro's name is changing to Accentra. So if anybody gets contacted by somebody at Accentra, that is KeyPro, that is our contractor for PASRR evaluations.
Thank you. Did you say that the medical plan ID box requires only numbers, or it can be letters as well?
It
Oh,
can
excuse
be
me,
letters
I
as well.
apologize. Only numbers and no letters. My apologies.
Yeah, it can be letters as well if your medical plan number has that information. So I don't know if it starts with an H and then there's letters and numbers, or I don't know what the what the record is going to have exactly. But we don't want to put like the name of the medical plan in here because it's going to use up the characters. We want just the identification number. So again, pick from the drop down on what type. Is it Medi-cal, Medicare, or private insurance? If it's private insurance, you don't need to list the name, just put in the medical identification number at the moment. If we see that we want to expand the field so that you can type in basically whatever you want, then we'll make that decision. And like I said, we'll push it out in a update coming up.
Thank you. Please go over when a patient needs a letter or does not need a letter. I understand you just said given the no need letter is optional.
Yeah, giving the need letter is optional depending on if you have an individual that you know might not react well to the fact that the need letter says that they might need evaluation. Some people misinterpret it when they read the need letter, and they think that it's stating they have maybe like a new diagnosis of something that they weren't aware of, and that might not be the case. So the no need letter you can give to them at any time, and make sure you guys actually hand the letter to the individuals. We've heard stories about the letters being put on a dresser and the person not seeing the letter until they're like discharged and they don't know what it is. The no need letter is pretty straightforward. It says that the person does not need a level 2 evaluation. There's no further action needed for the PASRR process. You can give that to anybody at any time. The need letter, it says give to the conservator and or the individual. And that is given to them to let them know that the PASRR process is not done and there's further action to be taken. I'm just saying, if you have a person who might not react to the letter well, you can wait for KPRO, our contractor, to reach out to you, because they're going to reach out to you if you get the need letter, because that's a positive level 1 screening. And then you can know based off of them reaching out when they call you if you're going to have an evaluation or not. If they do have an evaluation scheduled, you can give them the need letter and then let them know, hey, you've got an evaluation scheduled with the PASRR. If they do not need the evaluation, you can give them the need letter and then tell them that no further action was required, and they'll get another letter stating why the PASRR process ended. Sometimes it's an attempt letter, and there's many different attempt resolutions. The most common one is attempt no SMI, meaning that the level 1 screening was positive, KPRO took a closer look, there is no serious mental illness identified, and the case is closed. There's no need for any further action with PASRR. So again, you got to use your best judgment to see how your individual is going to react, and then determine if you need to give it to them right away or wait until KPRO calls to see what the result's going to be.
Thank you. Nursing facilities, please note that when that individual does come to your facility, we ask that you go ahead and look over that level 1 screening. So if you do see something that needs to be updated, that is on you to go ahead and do a resident review as a status update. So if you do see a mistake that the hospital made or they omitted some information, please note that we ask that you go ahead and do a resident review. Next question was asking, do we have an available tip sheet or reference sheet? Yes, at the end of this training, we are going to reference our website, and where you can see some of the future trainings and some of the information that we're speaking on, so you can read further.
Yeah, and we are working on that document, like a cheat sheet. It'll be out very, very soon. We're trying to finalize it now. It'll have where you need to look on certain letters for specific information, and so on and so forth. So yeah, we do have a cheat sheet in the works, and it'll be up on the website soon.
Thank you. We have been told that if there is no diagnosed mental illness, but they have been prescribed a psychotropic medication for sleep or for situational anxiety, depression, that we have to market. This triggers a positive level 1. Do we have to note these medications for this situation?
I'm sorry, can you read that one more time?
Of course. We have been told that if there's no diagnosed mental illness, but they have been prescribed a psychotropic medication for sleep or for situational anxiety, depression, that we need to market. This triggers a positive level 1. Do we have to note these medications for this situation?
Yeah, to be on the safe side, we do request that, and I'll get down to that question right now. We can take a look. And that's just to make sure nobody's falling through the cracks as far as the PASRR process goes. So here we see the question specifically asking for psychotropic medication. Has the individual been prescribed psychotropic medications for serious mental illness? Is the individual taking psychotropic medication regardless of when or where the medication was prescribed? This includes all medications used to treat mental illness, such as sleep medications. So to be clear, you do need to include it. Like you said, it's probably going to trigger positive. I mean, not probably, it is. Remember, anything marked yes in this section is going to trigger the screening to be on course to be positive. But that does not mean that a level 2 evaluation is necessary. So it's most likely going to be the case that your screening's positive, but KPRO is going to close it when they give you a call to see if the evaluation needs to take place.
You. If a patient is on a managed Medicare or managed Medi-cal plan, where does this fall under?
Right here, just Medi-cal or Medicare. You can just pick one of the two and put in the identification number here. Again, we're using the identification numbers and cross-checking them with other DHS systems. So this information is helpful, but we can use our resources to match the plan's identification number elsewhere in DHCS.
We had 2 level 1 screenings hold up discharge because it took a few days for screening to occur. Yes, please note, for if that screening is positive, HEPRO has, what is it, 3 to 5 days to reach out?
It's within 24 hours. If it takes longer than that for Keypro to reach out, you can reach out to them and give them a little nudge. We're trying to get the PASRR process, the entire thing done in 3 to 5 days, because that's how long on average, according to the statistics we got from the Hospital Association, that patients are in the hospital before they're discharged. So yeah, if it's been more than 24 hours and no one's called you yet from Keypro, you can reach out to them directly, and here's their contact information. And let them know that you have a positive screening. You can give them the case number and the CID number, and then they will work on getting it done. And you can also do that for those of you, I don't know if you guys have the time or not, but you can also do that as soon as your case is positive. You can call Keypro directly, and I recommend when you call it, it's a good idea to send them an email too. Give them the CID number. You can send over your medical records for that person to the contractor, and then that way they have all the information they need to get going on that screening to see if they need to schedule the evaluation or not. But
Wonderful.
hopefully, with the new level 1 screening, sorry, I keep talking. Hopefully, with the new level 1 screening, that delay doesn't happen as much because the contractor has your direct information. A lot of the times, the contractor has attempted to reach the facility to screen the case, but they're just having a hard time getting a hold of the right people. So hopefully, this update kind of cancels out that issue.
Thank you. Can the PASRR be completed based on clinical documentation only via a remote user? No requirement for a face-to-face interaction.
Yeah, there are situations where if it's best for the facility, they can do a telehealth evaluation. There are situations where the individual refuses to do the evaluation, whether it's in person or via telehealth. And then the contractor staff, the evaluators, they can get the evaluation done speaking with staff and using medical records. That's a last resort, but it is an option.
If there is an existing PASRR in the system from a previous admission and no health information has changed, is there an expiration date for the PASRR, or does each admission require one? Please note that PASRRs do not expire as long as the information matches the current individual's situation. That PASRR is good as gold. Only time that we ask for you to submit a resident review is if there has been a significant change in condition. If there is an existing, oh wait, sorry, read that one. If a physician adds a note in a referral with a statement of patient stating she has bipolar, but it's not an actual diagnosis, nor taking medication for it, do we have to add it for our diagnosis?
Yes, that's an actually good question. I don't know if we've actually received that specific question before. Yes, it'd be a good idea to indicate it, and that would be question 11. Oh, 10. Sorry, it used to be 11. Question 10 on section 3. So suspected mental illness. So you would just mark yes, indicate that the individual explained that they believe they're bipolar. Um, the screening would be positive if the categorical section isn't triggered. And then once you submit it, Keeper's going to take a look. They'll dig in a little deeper, and they'll determine if a level 2 evaluation is necessary or not.
Can the PASRR personnel call facility and ask for SSD so the information given will be more accurate, since they are the ones that do the PQH9 and no residents are seen by psychiatrists? Some nurses don't know much of that information.
That is a good question. I'm not sure if anyone else on the call, on the PASSR team, knows the details on that. Mariana, I think it'd be a good idea to submit that one to IT Service Desk for us to look into. But offhand, I cannot confirm if that's an option or not. But yeah, send us that question to IT Service Desk and we'll get back to you on that.
If a patient has a UTI and new onset of anxiety and started on anti-anxiety med, do we need to do a pass-off?
Yeah, that sounds like a reason for a resident review. Yeah, because anxiety disorder is listed as a diagnosed mental illness here in one of the examples. And they are starting psychotropic medication for the anxiety disorder. So yeah, that sounds like a good reason for a significant change in condition and a resident review. And remember, just because you're submitting a new screening and it's positive does not guarantee that that level 2 needs to take place. So it's possible that our contractor can take a look at all the information and say, you know what, they don't need a level 2.
Okay. PRM times 14 days only. Do we need to do a new PASSR?
Well, I'm not sure what PRN stands for. I'm not familiar with all the acronyms. I've got most of them, but every once in a while we get tossed a few that I've never seen before. So just for clarification, the only time you guys need to do a new PASSR is for a significant change in condition and for brand new admissions. So, for example, the one we talked about earlier was someone's going to the hospital and coming back. That amount of time they stay at the hospital, it doesn't matter. I've seen examples where folks are at the hospital for months and that PASSR that was already on file was still accurate according to the skilled nursing facility. So when they return, they didn't need to do a new screening. The only time you need to do a screening in regards to a time limit is if you admit somebody on the exempt hospital discharge. They have 30 days to be at the SNF without needing to do anything. If they're there longer than 30 days, then the skilled nursing facility needs to submit a resident review so that they can go through the PASSR process, since they didn't go before, since they were on the exemption. Within that 30 days, if the skilled nursing facility sees any evidence that they're going to be there longer than 30 days, they don't have to wait for that 30-day time limit to expire. They can go ahead and submit the RR as soon as they know they're going to be there longer.
Thank you. Do we need to use file exchange, or can we e-fax the pass results to the SNF? I think only approvers can do file exchanges. So please note that the users and approvers at the hospital can initiate the file exchange, but it's the approver that can accept it, not the user. Only the approvers can accept it. Moving forward, the file exchange is an actual requirement. And the reason why we're making it requirements because, once that information is with the SNF, now they have that information to do reconsiderations. They can submit information to the TARS, and the SNF can also use it for the auditing for the CMS and CDPH. So for whatever reason you weren't able to file exchange, we are going to ask that you try to find someone that is in the system that can go ahead and assist you to do the file exchange, because like we said, it is a requirement. We're not just asking for people to e-fax. If there's any situation where your facility system is down, no one can utilize the PASRR site, then yes, that's when we would ask for you to possibly give them the hard copies or the e-fax. But once your system is back in order, we are going to ask that you follow up and do the file exchange. So facilities, we are asking to do the file exchanges. That is our requirement now. What is the fix that is being offered so the level 2 screening will not delay discharge?
The fix that's being offered, so the level 2 won't be delayed, is the steps we went over earlier. I don't know if that's what the question is in specifically, but that's what the issue is. If you can't get your level 1 submitted, follow those steps that we went over. There was an email that went out last week on Friday, I believe, with those steps: clearing your cache, control F5 to refresh your page without using the stored data so that it'll get submitted correctly. And also restarting your computer should help. So if you followed all those steps and you cannot submit your screening, contact us at IT Service Desk. Again, remember, when you're filling out your screening, make sure that you're following the rules of these boxes up here. There's a direct phone number, mandatory field, facility discharge plan effects, mandatory field. If you don't have this information, you can put in all zeros and it should let you go forward. For the extension, it needs 5 digits if you use that field. Remember, if you don't have a 5-digit extension, and maybe your extension 4, 3, 2, 1 digits, preload the box with zeros so that you can pass the rule for 5 digits. And then the medical plan information, if for some reason you can't fit the medical plan number in the box, you can skip it by putting not available and going forward.
Thank you. I know we went over this question, but I would definitely want to reiterate. Please note that if nothing has changed with the individual, if there's been no new psychotropic medications, then that original screening that you have is good as gold. The only time that nursing facilities will do a resident review is if there's been a significant change in condition. And then on the topic of file exchange, please note that the screening needs to be closed. That means the level 1 has been done, and if needed, a level 2 has been completed. There is a closed date. That is when the facilities are able to file exchange. If you are not receiving the file exchanges from facilities, even though they stated that they sent it, please make sure you are checking your PASRR dashboard, especially the approvers. Approvers, please try to log in at least once a day, or maybe once in the morning, once in the afternoon, just to see if any file exchanges have been sent your way, because only the approvers are able to see and accept. If you do not see the file exchange, even though the facility said that they did send it to you, please reach out to IT Service Desk so we can look up that information. Please include your contact information, the CID number, just so we can look it up and see where that where that screening is for you. What happens when no one returns our calls on the weekend and we have to keep our patients through the weekend?
I can address this one. So that depends on who you're calling. If you call IT Service Desk, they only work Monday through Fridays, during regular business hours. If you have a case that needs to be worked on over the weekend, you should be calling KeepRoll/Accentra. Remember, they're the same people, just a name change. You should be calling them directly. So their information is here, and I can put it in the chat again. But that is who you want to reach out to on the weekends. KeepRoll/Accentra works all the time. They pretty much work around, I don't know about around the clock, but they work on weekends. And we do have DHCS clinicians working on the weekends, so that, once KeepRoll is done with their portion, if a case needs a determination, we do have clinicians working on the weekends to close those determinations.
Okay, thank you. And this is the part where I'm going to have to stop with questions. You guys had some very good questions that we were able to answer during the Q&A. If we weren't able to answer your questions, please reach out to our IT service desk, and I'll go ahead and put that in the chat. Go ahead and put that in there real quick. Awesome. And I think we are good. And like I said, any questions that weren't answered during this time, you're more than welcome to reach out to IT Service Desk, or you can go to our PASRR website. We do have a frequently asked questions where you can see any of that information that you are asking can be located there. And I'll go ahead and put that in the chat as well.
Yeah, so I want to remind everybody, we are going to have this same subject matter next week. I don't think we're going to record that one, but we're going to have it next week. This training that we recorded, we're going to try and put on the website ASAP. So keep an eye out for that. And we'll probably send an email blast, that email that everybody gets with any updates. We'll probably send out one of those once it's on there. So keep an eye out for that. But the schedule for next quarter should be up by next week as well. We're finalizing that right now, so just give everybody a heads up. So we don't record trainings often, but we figured this was an important one since the update seemed to affect a large number of people differently. So if you guys need to take a look to see how to clear your cache or how to fill out the new information, the new fields on the screening, you should be able to watch that video once it's up to answer those questions for you. All right, so that is it. Thanks everybody for joining the training today. Like I said, keep an eye out for the training next week. We're going to schedule that soon. Once we schedule it, we'll send out an email to let everybody know they can RSVP. And if you have any questions, I believe we have one Q&A hour left for this month, where you guys can join and just ask any questions you want, as long as they're PASRR related, and we will have a clinician present if you guys have any clinical questions that they can address. Thanks again for joining. I'm going to end the recording now, and we